This is Steve, and I'm here with Brandon Haushalter, who is the Chief Operating Officer of St. Joe Hospital.
That's right.
We appreciate your time this morning, Brandon.
Well, thanks for talking.
Sure. We want to talk a little bit about H1N1 and the situation and how it's developed and how things have gone here at St. Joe. We do know that the visitation policy has been lifted as far as the restrictions.
Right.
Talk to me a little bit about how that all came about.
Okay. Well, I'm going to back up a little bit and just sort of explain, I guess, the thought process that as a hospital, and really all hospitals in the country, went through in preparation for H1N1. We sort of take a three-prong approach, I guess, if you will. The first would be prevention and education. It's so important that the community and our patients and our staff all understand the measures that need to be taken to help prevent the spread of something like H1N1. So we have gone and placed sanitizing stations at all of our entrances. That includes sort of like your Purell type hand washing cleaning solution, tissues, and N95 masks. These masks are an effective way to help eliminate or reduce the spread of flu-like symptoms. So it's important that the staff and everybody use those effectively. The second piece was the vaccinations. I know we've all heard about the H1N1 vaccine and the lack thereof here recently. But we have gotten over 50% of our staff have been vaccinated for H1N1. Another piece of that is the traditional flu, and over 90% of our staff have participated in that program. So we recognize the importance of that and have highly encouraged that with our staff, and it's been a successful thing. And the third piece was the visitation policy. Children under the age of 18 have been identified as the most prominent carriers and the most likely to spread these symptoms. And so we did implement that policy, at the guidance of Dr. McMahon, here locally. Recently it has been lifted. It's been decided, I guess, that the risk is not there at this very moment. It's very possible that if things change, that visitation policy will come back. But right now we all do feel comfortable in restricting that or lifting that restriction.
This has been something that's kind of been on I don't want to say on the forefront, but it's been out there since earlier this year. We've been kind of watching it come towards us.
Absolutely.
A lot of planning that's gone into this. It's kind of also a situation that's in flux as well. It's constantly changing, and you're looking at updating things and keeping up with it. How has that been to keep up with it?
Well, it's a task because it does seem to change. Every day something else comes out in the news. But I think it's incredible, here in the community, how we've mobilized as a group of hospitals within the Lutheran Health Network and frankly with all of the hospitals in the community, and working with Dr. McMahon. We do have real-time guidance on the best way for us to approach the situation. So I've been very impressed with the Fort Wayne community and with how everyone has embraced the fact that this concern is here, and we're all doing the things that we need to do to hopefully prevent a worst case scenario.
Mm-hmm. Has there been some lessons that you can maybe take from this and apply to other situations? Lessons that you've learned?
Well, I think, from a preparedness standpoint, post 9/11 and even, pre 9/11, this is something that hospitals always focus on, particularly in the last 10 years. Disaster prevention and, infectious disease, spread is something that's absolutely, a focus of all healthcare providers. And like I said before, I've been impressed with the way the community has worked together on this, and I think from a communication standpoint, absolutely. Whether there was a tornado or a huge snowstorm or whatever the issue was, these communication channels are there, and I think it's shown that we do have the ability to all work together when we're presented with an issue like this.
Mm-hmm. Okay. Anything else that we should cover on this topic?
I don't know. I don't think so.
Okay.
Thank you.
Okay. Thank you.